Hi everyone, in this lecture we are going to be talking about surgical instruments. So a lot of this should be familiar to you already, maybe pick up a couple new things along the way. There are so many surgical instruments out there that there is no way that in the time that we have in this program that we are going to learn them all. But you will learn a lot of them, and as you continue through your career, you will pick up additional ones along the way depending on what specialties that you're in. But here, really, the goal of this lecture is to get you thinking about the different characteristics that instruments have, things that in ways that they're alike and ways that they vary, and be able to identify them by category. If we can do that, then that puts us in a really good position to be able to understand their function and the type of tissue that we use them on and how they are used in surgery. So there are a variety of things to consider when we are talking about instrumentation. First and foremost, the facility. It is not standard across the board to have the same things in a minor tray at one facility and find the same exact things in a minor tray at another facility. There's probably going to be a lot of commonalities. You're going to find forceps and clamps and suction tips and retractors, but the group of surgeons at one facility may prefer Goulet retractors, and the physicians or surgeons at another facility may prefer Army-Navy retractors. So there are going to be some variations, and that's why it's important to gain an understanding of the sterile processing department in the facility and to really learn what's in those trays. In many instances, we will be using more than one tray during a procedure. So those are some other things to take into consideration. Besides, surgeons may have their favorites, or they may have their special mallet that they have up separately, or a special tray that they use, and they want that for each of their procedures. It's also important to try to take a deep breath and not get too frustrated when we find that instruments have several different names. As I have said in class when I showed you the curved cryo or curved Kelly, surgeons are going to ask for a hemostat, a clamp, a snap, a cryo, a Kelly. They're thinking of the same thing in their mind, that 6-inch curved clamp that they can use to clamp and occlude tissue, and they may call it by a variety of names. And what they may nickname it at one facility or in one part of the United States even, they may call it something totally different in another part. So there may be some variations there, and so try not to get too frustrated with that. And then surgeons may not know the exact names, so they may make up their own name. One example I can think of is a upper extremity surgeon that I used to work with, and sometimes even though we were doing an upper extremity case like a hand, he would have us pull a foot tray for his case because it had more instruments than the hand tray did. So we would pull a foot tray, and there were a couple instruments in there called rongeurs, a smaller one and then a bigger one. And he called the smaller one Toe Jam Jr. and he called the bigger one Toe Jam. So it was TJJ and TJ. And the first time he asked me for Toe Jam Jr., I had no idea what he was talking about. So surgeons add their own little nicknames to things, so just be aware of that as well. When it comes to the manufacturing of instruments, there are different grades, and surgical grade happens to be the highest quality. It has the most chromium in it, and chromium is going to help strengthen the instrument. It's going to help keep them from getting tarnished or rusting those kinds of things. So there is a step down called an intermediate surgical grade, and that is used for instruments that are not subjected to high impact and are not used for cutting. Other types of grades are floor grade and disposable grade. So floor grade has a lower percentage of chromium. They're generally reserved for little bedside procedures that they do on the floor, like maybe removing some sutures or those kinds of things. And then there's disposable ones which cannot really withstand more than a single use. They break really easily, they break down and erode really easily, so we typically just toss them out after one use. And I can remember being at the VA hospital when I was doing my training to sit for my sterile processing certification, and we would pick up instruments from the floors, and there would be a mix of these 3 different kinds of instruments all thrown together. And when we got back to the decontamination area, it was so frustrating to have to separate out these 3 different types of instruments. Which ones were the really bad ones that needed to go in the trash? Which ones were the floor grade ones so that we could set them aside and package them differently to return them to the floor? And which ones had they come down to the sterile storage area and pulled out some instruments there to use on the floor instead? There are also different finishes of instruments. So the highly polished instruments are going to be the ones that have almost a mirror finish. They're super, super shiny and reflective, and they're going to produce a glare if we shine a bright light on them. The satin finish is not quite as shiny, doesn't have as much of a glare, but it has a higher tendency to get stained. The black chromium finish is going to be the type of instruments that are used in laser procedures because they do not reflect the light of the laser. That could be a hazardous thing because if light reflects off from the instrument, it could reflect onto the tissue where we don't want it to, and that could burn the tissue or whatever. Another type is the titanium anodizing, and that's where parts of the surfaces are titanium and other parts are not. A good example of this is different orthopedic implants. So I have some pictures of these coming up on the next slide. So for my visual learners out there, stand by, and my auditory ones, tune in, okay? So the titanium ones you're going to see are really colorful and really fun. They're like a rainbow of fruit flavors. And then the anodizing aluminum ones are more for the rigid sterilization tray. So it's a little bit lighter type of metal that they use, aluminum that they use. And then there are some instruments that you guys have already noticed that have the gold handles or the black handles. And that gold or black handle signifies that the jaw of the instrument or the cutting edge of the instrument, the blade, is actually tungsten carbide, all right? And a lot of times we see this in the needle holders. We see that black insert on the jaw of the needle holder, and that helps to give a better grip on the needle so that it doesn't slip or rotate. It also it is more longer lasting. It stands up to wear, I guess I should say, for a longer period of time. So here we're going to look at some instrument finishes. Can you guess what this first one is that is showing in your bottom right hand corner of your slide? If you said the ones that have tungsten carbide inserts, You would be absolutely correct. Let's look at another one here. What about this one? What would you say this finish is? It looks pretty shiny, right? Pretty reflective. That's probably the highly polished one or mirror finished one. These types of instruments are not good for use under a microscope where there is a very concentrated light. That's why we need that satin finish. And that's this guy here. This is the satin finish, this bottom left, the straight Mayo scissor, the Saint Mayo, if you will. This one here is the example of the black chromium finish, right? This would be used in laser cases. If you see these black, completely black instruments, those are going to be pulled for laser cases. What do you think this one is? The rainbow of fruit flavors. These are the titanium anodizing ones, right? Good for, typically use them for orthopedic implants such as plates or screws. And the color coding really helps us to identify the different sizes, and then also the instrumentation that you use with it could be color coded. The green screws go with the green drill, goes with the green screwdriver, goes with the green tap, yada, yada, yada. You get the idea. And then the last one here is just that example of the gold handle. So we have the black handle ones and the gold handle ones, signifying that tungsten carbide insert or cutting edge. Okay. So at this point, what I'm going to ask you to do is pause the recording for a virtual field trip. So after you pause the recording, you're going to navigate to the blackboard and click on that left-hand side where it says resources. Once you get in there, you're going to locate the Chapter 11 Supplemental Materials folder, and then you'll click in there, and then you're going to watch a video called How It's Made, and then come back and push play. Enjoy your video. So you should be familiar with these different categories of instruments. For the sake of this lecture, I'm going to try to focus on instrumentation that fits within each of these categories that we haven't really seen or explored yet. So a lot of these we've already seen, and so I'm not going to be going over them because I've gone over them in class and we've talked about them and looked at them. So I'm going to try to focus more on the things that we haven't seen, that we haven't talked about yet. So the first instrument that we're looking here is a ronger. And ronger is used for nipping and cutting away bone and some connective tissue. There are two different types of rongers, and they come in a variety of sizes, but the two types are single action and double action. And this one happens to be a double action. So what's going to happen is as we squeeze, I'm going to try to draw a couple arrows here. As we squeeze these handles towards each other, what's going to happen is right here, we're going to get movement, and then this part right here is going to move out that way. So there's going to create a space right there. These are going to move out away from each other, and then this jaw is going to bite down. The beauty of this double action ronger is that the leverage, the power that you have to put into squeezing this handle isn't nearly as much as with a single action, and you get more working power at the tip with less squeezing power at the handles. The second thing here is called a bone curette. There are different sizes of bone curettes. They look like a little baby ice cream scoop, and they come in different sizes, different lengths. Sometimes they're angled forward at the neck. We call those angled curettes. Sometimes they're angled back at the neck. We call those reverse angled curettes. Again, good for scraping bone. The next one that you see here is called a bone cutter or a bone shear. Again, used for cutting bone. And then the last example we have here is a variety of osteotomes or chisels. And anytime you pass an osteotome or a chisel, which is going to be used to cut bone, just as the name implies, you will want to pass a mallet as well, because they're going to use the mallet and they're going to hit the back of the chisel or the osteotome with the mallet, and that's going to help push that tip into or along the bone to cut it. Our next category is clamping and occluding. So we've talked about hemostats, mayopions, curved hemostats, straight hemostats, straight and curved cryals and Kellys, straight and curved mosquitoes. There's a variety of different clamping and occluding clamps. There are also a bunch of different vascular ones. So here's a couple of vascular ones that I picked out to show you. The one on the left is called a Satensky clamp. That might have also been in the How It's Made video. I'm not 100% sure. But this is used for clamping large vessels. And then on the right side is called a bulldog clamp. And this is used in vascular surgery to clamp very small vessels. Moving on to grasping and holding, we've looked at a variety of grasping and holding instruments like the Alice, the Coker, the Babcock, some that we might not have looked at yet. The single-tooth tenaculum, this is the first one on the left. It's used for grasping and holding the cervix when we're doing DNCs or something of the sort. The middle one is called a Leahy clamp. It is good for when we're removing like biopsies from the breast or something like that. And then we've talked about a variety of different forceps. This one happens to be a Ferris Smith forceps. Retracting and viewing. Retracting and viewing we know can be handheld or self-retaining. An example of a self-retaining retractor that is used in the vagina is called the Graves speculum. That's the first one on the left. Also sometimes called a duckbill or just a vaginal speculum. The second one from the left, this is an Avard weighted vaginal speculum. It is very heavy. It has this big bulbous end that makes it pretty weighty, and the retractor part of it just gets inserted into the vagina and it hangs, and gravity helps it to pull open the vaginal canal. The one next to that is a self-retaining retractor called the Finichetto, and that guy is used to retract the sternum and the thoracic cavity. And then the last one is a little kind of a different animal. This is a lighted breast retractor. So a light cord hooks on to the bottom of this, and then the light shines out the top along the top of the retractor blade. So this is something a little bit different. Aspirating and suction. There's a variety of different types of suction tips. Here we see the Fraser at the top, which comes in a variety of different sizes. The Yankauer, which is a pretty common one, and then the Pool tip is a common one as well. The Pool tip and the Yankauer tip, they have two pieces minimum and both need to be counted. The Fraser suction at the top has a stylet that gets pushed into the back, and it actually can traverse the length of this like this, because these have a tendency to get clogged really easily, and so we like to have a stylet so we can clean them out when that happens. Suturing instruments. We've looked at various needle holders like the Mayo Hagar and the Halsey and the Webster. A couple new faces. This one on the left is called a Haney needle holder, and it is a curved needle holder, typically used in urology and GYN procedures. And this one on the right is called a Castro Viejo. We'll see it again down the line here, a couple slides, but is also used in microsurgery and vascular surgery as well. And it has the locking mechanism inside the handle here, as you can see. Stapling instruments. So we looked at skin staplers, we've looked at ligating and dividing staplers, linear cutters, and transluminal staplers. But we also use staplers when we do laparoscopy. So these are a couple examples of laparoscopic staplers. If you do a laparoscopic epi, you will most definitely be using one of these animals. And you can see how they have these different colored cartridges down here. They have different jobs that they do. Some are vascular, some are more for adipose, some are for heavier tissue, and it does indicate that on the packaging. And these can be reloaded into the tips of these devices. These are single-use devices, though. Dilating. The top ones here, these are called Van Buren sounds, and they're used to dilate the urethral meatus, so urologists like to use those. The ones below the Van Buren sounds are called the Hanks dilators. These are used to dilate the cervix. The way that I remember these is if you see this little doohickey right here on each side, I call these hats, and so I remember them as Hanks have hats. And then the bottom ones are called Pratt dilators, again also used to dilate the cervix. And then the reason that we do that is so that we can gain entrance into the uterus. Accessory instruments is kind of a catch-all for instruments that don't fit into the other categories. A couple that I put here for you. On the left, this is called a uterine sound, and they will insert this through the cervix and kind of give it a little push until they feel some resistance against the back of the uterus. And you can't see it, but this has like little hash mark measurement lines, and it will tell them the depth from the cervix to the fundus of the uterus. And then over here on this other side is a representation of orthopedic trials, or sizers, if you will. So anytime we do any joint replacement or anything like that, before we open up the real deal, because that is really costly, inside our trays are these pretend implants called trial implants. And so the surgeon's going to want to trial the sizes that he or she wants to make sure that they are appropriate before we open the real implants. And then here's an image of micro instrumentation. You can see the middle one is again the Castro Viejo, but a non-locking one this time, which is a lot more difficult for us because you will still load the needle in the tip here, but then you have to keep it closed as you pass it. So it's a little bit more difficult. And then we have a forceps and a little angled scissor as well. And you can see how they have the satin finish. So when they're working under that light of the microscope, there's not a blinding reflection going on there. As far as instrument design, we've already talked about this, but instruments have anatomy, right? The ones that have like the ratchets and our scissors, they have those finger rings. Right? They come in different lengths. They come in different weights and thicknesses. Some have teeth, some don't, and they have a variety of shapes. So as as we've discussed previously, if we're talking about a ringed instrument, there are those distinguishing factors. The working part of that ringed instrument is called the jaw, and the jaw is what tells us what kind of instrument that it is. Looking at the finger rings is not going to give us the distinguishing characteristics to be able to identify that instrument. The shanks are the connection between the box lock and the rings, and then the ratchets are the locking mechanism that we've looked at before. Okay, and again, instruments are designed for specific uses. So if they're heavy, we pair them with heavier jobs or tissues, and delicate would be the opposite. Are we working very superficially on delicate tissue? Then we're going to want a short, very delicate instrument. If we're working deeper in the abdomen, surgeon's going to want a longer instrument. Okay, depending on if we're working on really delicate tissue like the bowel, or if we're removing an ACL or the meniscus of the knee, let's say, we're going to need different types of instruments that do that. The bowel is really delicate, so we would want to grasp it with something that's not going to damage it. Different retractors come in different widths and lengths, as we have seen in the past. They can also be angled or straight. An example would be the curette. The curette can be straight, angled forward, or angled back. They can either be smooth or they could have teeth, which we have seen as well. So now it's time for your second and final virtual field trip. So I'm going to ask you to pause the video recording, navigate to the Blackboard one more time and click on that resources tab along the left, navigate to the Chapter 11 supplemental materials folder and watch the instrument slideshow video and then return to this lecture. So I hope that you enjoyed that video. It gives you a visual of a bunch of different types of instruments, but are grouped together by specialty. So my question to you is, were you able to categorize any of those instruments that you saw in the video? Was it easy? Was it hard? Were some more easy than others? And why do you think that is? Maybe have a little discussion with your group. Maybe go back and watch it again and kind of wait for a type of instruments to come up and maybe pause, discuss what can you glean from the instruments that you see. Because again, we can't memorize every single instrument on the planet. We're going to have to we're going to be put in situations where we might not know what this thing is called, but we can get close enough to characterize it, to categorize it, and to understand what its basic function would be. And that's the whole purpose of those questions that I'm asking you now. So another thing we take into consideration, like I've said already, is the tissue types. So the instrumentation that we use, we base that on the type of tissue that we're going to use it on, the depth of the surgical wound, the technical requirements, of course the surgeon's preference, and experience, right? At the end of the day, we want to be able to anticipate our surgeon's every move. We are watching the field, we are observing what's going on, and we can intuitively, by looking at the field and the tissue and knowing our surgeon and the procedure and the anatomy, be able to put that instrument in the surgeon's hand when he sticks it out, or she does, without them having to say a word. Now, we already know that tissues differ by texture, strength, elasticity, permeability. Is it delicate? Is it tough? All right, so types of tissue that the book talks about is skin, which is super tough, visceral serosa. So here we're talking about the bowel, the stomach, Friable tissue. Friable tissue is tissue that's going to tear really easily. When we get these older folks and we're operating on their aorta or their hepatic artery, there is a good chance that it can tear a lot more easily, and it can also be difficult to stitch as well. Friable tissue can also occur when we have a patient that has had cancer and they've had a treatment of radiation to that area. That can also cause the tissue to be unhealthy and more friable. Elastic type tissues, we're talking about connective tissues. Boggy tissues like the spleen, the liver, the kidneys. We don't want to grab them or retract them with anything that's going to bite or jab or poke, because those tissues are very friable. And even when we attempt to sew those tissues, which doesn't happen very often, we use a blunt needle. And the blunt needle, it's like using a butter knife. All right, it's completely blunt. You could poke your finger, you can poke it into your finger, and it wouldn't hurt at all. So we treat that tissue very specially. Adipose tissue, of course, is fat tissue, and then there is bone tissue. So just to wrap it up here, talking a little bit about our knowledge base for instrumentation. We talked about the classification of instruments, and as you gain experience, you will start to marry processes together. For example, if I pass the surgeon a stitch, I know I'm going to need to pass him or her a forceps. And at some point, I'm going to need to cut the stitch. So those are three things that go together almost all the time. The relationship between the design of the instrument and the instrument's use in the body. Remember, we think about tissue, we think about depth, we think about surgeons' preferences, and we go by our experiences as well. It's important that we care for the instruments intraoperatively, that we make sure that they don't get damaged and they're not being used for things that they're not supposed to be used for, like a needle holder trying to bend a plate that we're going to use to fix a bone with. It's not meant for that. There's special instruments that are meant for that. Also, the correlation between a specific surgical procedure and the instrument required to perform it. We know that there's different surgical specialties and there's different specialty instruments that line up with those specialty procedures. And then our ability to recognize high quality instruments over those that malfunction or need repair. When we're setting up our field and we're pulling our instruments to set up our Mayo stand, our job is to look at those instruments and make sure that they're functional. Take the Adson with teeth and squish it together and see if the teeth fit. If it feels weird or something's not right with it, or you're closing a ratchet and it's springing back open, you don't want to give those things to your surgeon. It's our responsibility to mitigate that, those situations so that those things don't get passed on to the surgeon, and so that we communicate that to sterile processing so they don't get back to the surgeon on the next case. Because nothing's more frustrating for a surgeon to be using some special instrumentation and one's malfunctioning, and then he or she gets that same malfunctioning one for the next case. We want to make sure that we try our best to avoid that. All right, so the question that I'm going to leave you with is that you can discuss in your groups is, how can instruments directly affect our ability to anticipate a surgeon's needs, and how can we function better with recognized and unfamiliar instruments? It's our job to anticipate the surgeon's needs. It's our job to know what the surgeon needs. It's also our responsibility to know how every instrument works and what its function is, and be able to get it to the surgeon in an effective way so that they can use it right away without having to fumble or fuss. Okay, everyone, that is going to sum up our lecture on instrumentation. I hope that you found it insightful and you had some takeaways. I look forward to reading your muddy points and being able to circle back on some of those questions that you have. Thanks for listening.